If you've just learned that your child has been identified as a close contact to someone who tested positive for COVID-19, we know it can be scary. What does that mean? What do I do? CG Public Health is here to walk you through the necessary steps you should take to maintain the health of your child and the safety of your family. If your child has been identified as a close contact to someone who tested positive, it is important to follow 3 steps over the next 14 days following their last exposure. First, monitor your child for any signs of illness, including cough, a fever of 100 degrees or greater, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle or body aches, headache, sore throat, new loss of taste or smell, fatigue, congestion or runny nose, nausea or vomiting, and diarrhea. It's important to note that your child may only have one symptom, and the symptom may be mild. Second, if your child develops any symptoms, they need to isolate from others. Isolation means staying in a separate room from others in the home if possible, using a separate bathroom if possible, avoiding contact with other members of the household as well as pets, and not sharing personal household items like cups, towels, and utensils, and wearing a mask around other people if able. As a parent, we know this can be difficult, and we encourage all adults to get vaccinated against COVID-19 to help your chances of not getting severely ill when caring for your child. While isolating, you need to make arrangements for your child to get tested. Options include your child's primary care provider, always call ahead to schedule an appointment, Mercy One Urgent Care, you can go online to schedule an appointment, or Quick Care Urgent Care, call 641-450-7000 to make an appointment. If your child's test results are positive, all household contacts will need to remain in quarantine following their last exposure to your child. Fully vaccinated household members do not need to quarantine unless they develop symptoms. Third, if your child remains asymptomatic and you wish to have testing done, your child does qualify for testing since he or she has been in close contact with a lab-confirmed case of COVID. It is recommended you wait 5 to 7 days after your last exposure to have testing done. And remember, if testing is done at day 7, there is still a chance your child could become sick from their exposure up through day 14, so continue to monitor your child for symptoms. The absolute best way to avoid any of the scenarios we just discussed is to have everyone in your household who are 12 years of age or older vaccinated against COVID-19, and having everyone in your household wear a mask over their mouth and nose whenever they're in an indoor public setting. The combination of these 2 efforts will be the best way to keep our kids in school and our parents at work. The 3 vaccines currently available in the United States are widely available, free, and safe and effective in stopping serious illness and hospitalization from COVID-19. And masks have been proven to help stop the spread of COVID-19. Call CG Public Health at 641-421-9300 if you have any other questions or concerns.